Hey, future nurses. Imagine you're in clinicals, and your patient with HIV is struggling to lift their arm during your assessment. What's your next step? Today's topic: HIV-associated muscle wasting, a key topic for NCLEX. We'll use the ADPI framework to break it down, plus tackle an NCLEX-style question to boost your clinical reasoning. Let's get started. HIV-associated muscle wasting, or cachexia, is a critical condition nursing students need to master. It's not just about weight loss. It's about muscle breakdown that impacts a patient's strength and quality of life. For NCLEX, understanding this condition helps you prioritize interventions and ace those tricky questions. We'll use ADPI, assessment, diagnosis, planning, implementation, and evaluation to guide us, plus share a must-know NCLEX strategy. Ready? Let's jump in. First up, assessment. When evaluating a client with HIV for muscle wasting, look for diminished strength, like difficulty lifting objects or walking. Patients might report fatigue or weakness in daily activities. You'll also assess for unintentional weight loss, but it's typically less than 5% of body weight over 6 months. Check for signs of gastrointestinal issues, like diarrhea, which can signal malabsorption, a key cause of muscle wasting. Use tools like grip strength tests, or ask about changes in physical activity. For example, a patient might say, "I can't carry my groceries anymore." That's a red flag. Next, diagnosis. Based on your assessment, a key nursing diagnosis is impaired physical mobility related to muscle weakness from HIV-associated cachexia. Another is imbalanced nutrition, less than body requirements due to malabsorption or increased metabolic demands. Why does this happen? HIV triggers inflammation, ramping up calorie use and breaking down muscle protein. Risk factors include advanced HIV, poor nutrition, or opportunistic infections. For NCLEX, remember, muscle wasting isn't about fat redistribution. That's lipodystrophy, which causes fat gain on the neck or trunk, not muscle loss. Now, planning. Your goals are measurable and patient-centered. Aim to improve muscle strength, like increasing grip strength by 10% in 4 weeks. Another goal is to stabilize weight and ensure adequate nutrition. Prioritize collaboration with dietitians and physical therapists. For example, plan for a high-protein diet to combat muscle loss and a tailored exercise program to boost strength. For NCLEX, always think ABCs: airway, breathing, circulation. But here, nutrition and mobility are key to prevent further decline. Time for implementation. Introduce cachexia, our key term. It's severe muscle wasting and weight loss from chronic illness like HIV. Your interventions include collaborating with a dietitian for a high-calorie, high-protein diet. Think protein shakes or nutrient-dense meals. Encouraging resistance exercises like light weightlifting, tailored to the patient's ability. Administering prescribed medications like antiretrovirals to manage HIV progression. Educating the patient on energy conservation, like pacing activities to avoid fatigue. For example, if your patient struggles to walk, suggest short, frequent walks with rest breaks. These actions address both symptoms and causes of muscle wasting. Finally, evaluation. Check if your interventions worked. Has the patient's grip strength improved? Are they maintaining weight? Monitor for increased energy levels or reduced fatigue during activities. Use tools like weight checks or muscle strength scales. If goals aren't met, reassess. Maybe the diet needs tweaking or an infection is worsening the cachexia. For NCLEX, always evaluate outcomes against your planned goals to ensure patient progress. Let's test your skills with an NCLEX-style question. Question: a nurse is assessing a client with HIV. Which finding indicates HIV-associated muscle wasting? A. Unintentional weight loss of 15% in 6 months. B. Fecal impaction. C. Diminished strength. D. Increased fat gain on back of neck. Correct answer: C. Diminished strength. Rationale: HIV-associated muscle wasting, or cachexia, causes muscle weakness and reduced strength due to protein breakdown from inflammation or malabsorption. Option A is incorrect. Weight loss is typically less than 5% in 6 months. Option B, fecal impaction, relates to constipation, not muscle wasting. Option D describes lipodystrophy, not muscle wasting. Clinical tip: on NCLEX, if you see diminished strength with HIV, think cachexia, not lipodystrophy. Prioritize assessing mobility and nutrition. That's a wrap, nurses. You now know how to tackle HIV-associated muscle wasting using ADPI and ACE-related NCLEX questions. Subscribe, like this video, and hit the bell for more NCLEX prep. What's the toughest NCLEX topic for you? Drop it in the comments.